I think at some point we're just going to end up getting COVID, but I feel better that we at least we have some protection against it.
Morelle Durham is taking her kids to get their second COVID shots, but she's in the minority.
I find this is a missed opportunity because we have a really well-evaluated vaccine also for children.
Parental hesitancy is understandable. Everyone wants only what's best for their kids, but is messaging partly to blame? Our National Advisory Committee on Immunization says 2 doses may be offered to children 5 to 11, not should. And families can face a barrage of misinformation in chat groups and less than credible sources.
There's no doubt in my mind that the effects of the illness itself, both short-term and long-term, are much more detrimental to children than the vaccine.
Health Canada says no safety concerns were found in clinical trials of Pfizer's pediatric shot, and recent data from the U.S., where more than 8.6 million doses have been administered to kids 5 to 11, reveals side effects are exceedingly rare. Calgary pediatric emergency physician Stephen Friedman studied hospitalizations in kids who do get COVID and stresses the importance of vaccination.
What our study shows, if they're severe enough to be hospitalized, they have a risk of a severe adverse outcome.
But shot or not, experts admit Omicron is now changing the landscape.
I think it's really important that we strongly advocate for the vaccines for those who are vulnerable to landing in hospital. That's been the power of the vaccines, and that's still holding true with Omicron. But I also think that we have to be honest about that the vaccines are not, in fact, stopping transmission. If they did, we wouldn't be in this situation.
A situation we have to adapt to. But the science is clear. Vaccination is still the best option we have to protect ourselves and our kids against COVID-19. Jamie Mauracher, Global News, Toronto.